Hello guys, today we are going to discuss about a blood test called cystic fibrosis genotyping. Use of the test to detect cystic fibrosis genetic mutation to establish CF carrier status or to establish the diagnosis of cystic fibrosis in an individual. When to get tested? When a newborn baby has no stool in the first 24 to 48 hours of life, or when a person has symptoms of CF, if a person has a positive sweat chloride or an immunoreactive trypsin test, or a close relative who has been diagnosed with cystic fibrosis, or when a patient is undergoing genetic counseling and wants to find out if they are cystic fibrosis carrier. In addition, high risk carrier couples may have the test prior to in vitro fertilization so that the test can be carried out before implantation. Introduction. The cystic fibrosis gene mutation test identifies mutations in the CFTR gene. Each cell in the human body has 46 chromosomes, 23 inherited from the mother and 23 from the father. Genes on these chromosomes form the body's blueprint for producing proteins that control body functions. Cystic fibrosis is caused by a mutation in a pair of a gene located on chromosome 7. Both copies of this gene must be abnormal to cause CF. If only one copy of this pair is mutated, the patient will be a carrier. Carriers are not ill, they do not have any symptoms, but they can pass their abnormal CF gene copy on to their children. So far, over 1,500 different mutations of the chromosome 7 gene have been identified, but only a few of the mutations are common. The majority of CF in the UK is caused by a mutation called Delta F508. When CF gene mutation testing is done, the laboratory specifically examines the CFTR gene on each chromosome 7 for a number of mutations. If the initial panel of mutations demonstrates a mutation, additional testing for other mutations may be done if the individual is suspected of having the disease. Sample: a blood sample taken from an infant heel, a spot of a blood that put onto filter paper, or a blood sample taken from a vein in the arm. Normally, no mutations